What's up, everybody? Dr. Rossi, shrinksandsneakers.com. I've been asked a couple times and had a few comments asking me to cover medical cannabis or medical marijuana. So I'm going to do that in the context of chronic pain here, but I'm going to hit on a couple of important points that relate to medical cannabis in general and some of the nuances that go along with it. So patients always have this question. I can't tell you how many patients come in with this question or are already receiving medical marijuana for any number of conditions. Now, there's a number of medical conditions that are basically based on the state's recommendations for what would be considered adequate for treatment with medical marijuana. So it's a state-by-state basis. The conditions will be specific to your state, and again, it will depend on what they decided are the proper conditions for treatment with medical marijuana. Now, there's been a steady rise in the use of cannabis in general. So if we look at the data from 2002 to 2019, what we see is that in 2019, 17.5% of the American population used cannabis. So this is just in general. This is not specific to medical cannabis, but this is just showing that there's a significant increase in the use of cannabis and the acceptance of cannabis as a recreational drug, as a medical medication, and we're seeing a significant increase. Now that's up. In 2002, it was only 11% of the population. So we're seeing a significant rise in the use of cannabis, and again, it's no surprise that many patients who have psychiatric disorders are asking about cannabis and how to use it, what conditions it's good for, and what evidence do we have to support its use, not only for psychiatry, but also for medical conditions. So I want to start by talking to you guys a little bit about the cannabinoid classification in general. So this is based on the National Institute of Drug Abuse classification system. So this is the National Institute of Drug Abuse. This is their way of classifying the components of cannabis or marijuana. So we have what's called photocannabinoids. So photocannabinoids are naturally derived from the flora, meaning things like THC, tetrahydrocannabidiol, and CBD, cannabidiol. So we have two things, THC, CBD. So the phytocannabinoids are derivatives from the plant itself. Now, in our bodies, we actually have what's called an endocannabinoid system. So these are actually endogenous, created by the body, cannabinoids. So that would be things like anandamide or 2-AG. So these are two things that we do see. Now, synthetic cannabinoids are things that are created artificially. Now, these have gained a lot of prominence over the years. They're sold sometimes on the street, sometimes sold in smoke shops and things of that nature. And those could be things like K2 or Spice. And those are kind of dangerous because they're very, very potent. But then we also have some of the other medications that are commonly prescribed in medicine, and that would be something like Marinol, which I'm going to talk about in a minute. So the two most commonly known components of cannabis products are tetrahydrocannabinol and CBD, or cannabidiol. So THC, as most of you guys already know, that's the psychoactive component of marijuana or cannabis products. Now, an important point about THC is that over the years, what you've seen, whether it's medical dispensaries or it's recreational dispensaries in states where it's legal for recreational use, what we see is a significant increase in THC concentration. Now, that is coupled with a decrease in cannabidiol. So what we used to think was that and what we still think, is that the cannabidiol is protective against those components of things like psychosis, where the THC is part of what could potentially precipitate some of those things like psychosis in younger patients specifically. But we want to be mindful that the products that are being sold in these dispensaries, and even on the street of course, are much higher THC concentration than they were in previous years. Now there's also other cannabis products which I have a good case report on that we did, and that was on dab or shatter. So these are the butane hash oils, which can have THC concentrations of 80% or better in some cases, depending on the circumstances and the preparation. So being mindful that the psychoactive component of these medications is increasing significantly, while the protective portions of it, the cannabidiol, the CBD, is decreasing in a lot of these strains and preparations of these products. So I want to move to a brief discussion on the medically approved uses, because there's actually a handful of medically approved uses, and there's a few marijuana-based or cannabis-based products that are already out there. So let's talk about those specific conditions. So the medical conditions where cannabis products have been approved in the United States include AIDS-related anorexia, so that's one, chemotherapy-related nausea, seizure disorder, specific kinds of seizure disorder, and multiple sclerosis, so MS. Those are the ones that are where we actually have approved uses for cannabis products. Now, there's a medication called Gernavinol, or better known as Mirinol. So these are synthetic forms of THC that are used in the treatment of chemotherapy-induced nausea and vomiting, as well as anorexia associated with AIDS. So we can actually use Mirinol for patients who have chemotherapy-induced nausea or those with anorexia associated with AIDS, and this is again a synthetic THC product. We have a cannabidiol product that's a synthetic form of CBD that's used in the treatment of rare forms of epilepsy, and these are very rare forms of epilepsy. One of them is tuberous sclerosis. Again, not very common. It's not your standard epilepsy. These are ones that are not very receptive to some of the more common medications that we might use to treat seizure disorders. In Canada and Europe, there are several other THC and CBD products that are used in the treatment of neuropathic symptoms associated with multiple sclerosis. So again, multiple sclerosis was another indication for THC and cannabidiol products. So another thing I want to talk about here is the treatment of opioid use disorder with cannabis or cannabis-based products. So these are observational studies, and when we talk about observational studies is that these are correlation studies, and it does not necessarily imply that legalizing marijuana causes less opioid use. But one study was able to determine that where medical cannabis is available, there seems to be less opioid prescribing by physicians. So medical cannabis, theoretically, the way that they're kind of correlating this is that medical cannabis leads to a reduction in opioid prescribing in those areas where it is available. Now, there's some additional evidence from a study by the Journal of American Medical Association, JAMA. They did a study that indicated a reduction in overdose deaths in areas where cannabis is legal. However, I always want to caution people that there is evidence that increased use of cannabis can also lead to the risk of developing opioid use disorder, and that's from the American Journal of Psychiatry. So there's conflicting evidence in this area. So there's a couple studies saying, it reduces opioid prescribing, it reduces overdose deaths in areas where it's legal, and then there's other situations where it says that, hey, no, it doesn't. It actually results in the development of opioid use disorder. So that came from the American Journal of Psychiatry. So conflicting evidence, it's not really clear what the actual answer is. So what we do in these cases, when we don't know the evidence isn't really supporting it one way or the other fully, we'll go to societies like the American Society of Addiction Medicine, or ASAM. Now, ASAM is a well-respected institution and organization. They create a lot of the criteria for the treatment of these disorders, and they released a policy statement in 2020, and they basically said that there's a lack of sufficient scientific evidence for the effectiveness of cannabis as a medication for many of the indications by the states. And that was the point I was making earlier, was that states where it's legal for medical or recreational use, they've essentially created their own list of conditions that they feel medical cannabis could be used for. Now, of course, they've had consultants, they've had doctors that have consulted with them in making this list, but it's very controversial whether or not those lists are even valid and whether or not there's enough evidence to support their use. So here's the American Society of Addiction Medicine coming out saying, well, we don't think there's enough evidence to support a lot of the indications that the states are approving medical cannabis for. So I would say that I would trust the American Society of Addiction Medicine more than I would trust, arbitrary state decisions based on which conditions should be or should not be treated with cannabis products. And ASAM specifically emphasized the idea of the association between cannabis and psychiatric disorders, specifically psychosis. Now, that is well established in the literature, and it's not really even a debatable point at this time that people who start using cannabis earlier and use large amounts of cannabis products do have an increased risk for psychosis. And again, I wrote that paper where we looked at somebody using dab who ended up having a psychotic episode that resulted in inpatient admission and treatment. So these are significant things. Another important point I want to make about cannabis is that insurance does not pay for medical marijuana, so you got to pay out of pocket. What often happens in my experience is that somebody will get certified, they'll pay the $450 or whatever it is for the initial consult to get their medical marijuana card, and then what they'll do is they'll go and buy the marijuana off the street because it's cheaper. The dispensaries are very expensive. They cost a significant amount of money, significantly more than what it costs to buy on the street. So what you do is you get your medical cannabis card and you say, oh, well, this is medical cannabis. It's not all, off the street. So if you get, if you end up in a situation where, police or whatever involved and you have your medical cannabis card and you're carrying, an amount of cannabis with you that is sufficient for personal use, then it could be off the street or at a dispensary. It really doesn't matter. You're kind of covering yourself there. So that's not ideally the way to do it. Obviously, we prefer people to go to the dispensaries, but the expenses and costs and the lack of insurance coverage make it difficult for many patients to purchase the cannabis products legally at dispensaries. That's a very important point and a nuanced point that not everybody's talking about. My final piece here is that cannabis remains federally illegal. So even though the states recognize it as legal, it's not technically legal in the eyes of the federal government, so that makes it very, very difficult. And what I mean by that is if we want funding for research, if we want to really study and do those randomized controlled trials to figure out what are the real benefits of cannabis, what are the real harms of cannabis, we're not going to figure those things out with federally funded money or federally funded grant money to do the research because it's, again, seen as an illegal drug. So as physicians, what do we need to do? We need to be aware of the patterns of use. We need to be aware of the adverse effects. We need to be aware of the various formulations, THC concentrations, like I say, being one of those major issues that we're seeing more from a psychiatric perspective. Some data supports the use of cannabis for various conditions. We listed those above, things like AIDS-related anorexia, chemotherapy-induced nausea, muscle spasms in MS, and certain types of seizure disorders. So there are some situations where cannabis has good evidence to support its use. However, the data remains limited for the chronic conditions that most people are looking for treatment. Things like chronic pain, substance use disorders, and most of the medical societies have said that and have agreed that until we have higher quality data, we cannot recommend the use of medical cannabis for the conditions listed by most states. So in many cases, a lot of the medical societies do not agree with the use of cannabis that's been supported by the states. I'm going to stop there. Hopefully this is a decent introduction to some of the cannabis-based products and some of the uses, medical indications, and some of the nuanced points about how medical cannabis is being marketed and used within each individual state. If you guys have questions or comments, drop them below, and please like and subscribe to the channel. It helps us to keep making videos.